Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another really fascinating guest involved in creating a better tomorrow. Today, we have the honor of being joined by Karen Zaderej, who is the chairman, Chief Executive Officer, and President of Axogen Corporation, which is a leading company focused specifically on the science, the development, and the commercialization of technologies for peripheral nerve regeneration and repair, with a primary goal of helping to restore peripheral nerve function and quality of life to patients with physical damage or discontinuities, ultimately providing these innovative, clinically proven, and economically effective repair solutions for surgeons and various healthcare practitioners. Karen joined the company in 2006, served as their president, CEO, and member of the board of directors since 2011, became chairman 2018, and has previously held various positions, including COO and vice president of marketing and sales. And prior to joining the company, founded her own medical consulting company, assisting various medical device companies to ultimately build and execute successful commercialization plans. Prior to that, from 1987 to 2004, Karen was at Ethicon, part of the J&J companies there, holding senior positions in marketing, business development, R&D, and manufacturing. Karen is a member of the University of Tampa Board of Trustees, sits on the board of directors for EyePoint Pharmaceuticals. She has her MBA from the Kellogg Graduate School of Business and Bachelor's of Science in Chemical Engineering from Purdue. A lot of really interesting themes to get into today. We're honored to have her. Karen Zaderej, thank you so much for taking the time to come on the show.
Thank you. Thank you for having me.
It's wonderful having you. As I typically do, I love to start these episodes off learning a little bit more about you and everything leading up to this point. Clearly, you spent a lot of time at J&J and Ethicon, learning surgery technologies, learning about wound healing. Tell us your background story a bit, sort of what you've been doing before Axogen.
Oh, thank you. I get asked a lot, especially by students, to say, how did you get to be CEO of a first a startup company and now a full-blown commercialization company working in a unique and growing area? And it doesn't happen overnight. It's really around skill building and learning to lead and learning to be able to make decisions in the face of ambiguity and steer through those decisions so you still reach the goal in the end. And I think I got a lot of understanding and learning at Johnson & Johnson. It's a fabulous company to work for, to go through training and get development opportunities. And as you said in that somewhat lengthy bio, I had a lot of chance to do a lot of different functional things. And that's what I wanted to do. For me, I was always curious about what people did in other parts of the organization. So I learned about manufacturing and about product development and business development and strategy, and then ran a worldwide business unit. And all of those gave me both leadership skills, but also functional knowledge about how a company works and what all the pieces are to make a company successful. How do you commercialize things? How do you innovate things? How do you make sure you've got a back end that you can supply reliably good, high quality products? And a company like J&J just gives you premium education to learn those things, both in training programs, but also on the job and doing those things. And I valued that, but I also really developed an affinity for new things and trying to innovate in new areas. And big companies, at least in medical devices, mostly buy that. They don't do that from the ground up. And I decided, I really want to go and leave J&J so I can do something new and start my own business that is really focused on innovation and changing healthcare in an area that I think is meaningful. And I didn't know what that meant exactly. So when I quit, my friends at J&J thought I was out of my mind because I quit without a job. And I said, well, I'm going to go start something. And they're like, but you don't have a job. No, that's right. I don't have a job, but I'm confident that I can, make a job both for myself and for other people in this vision of changing healthcare in an area that I hadn't identified yet. And so I went out and started talking with tech transfer groups at universities. I started working with VCs. In the meantime, I also figured out, and I guess I knew this before, but figured out I got to raise money along the way because healthcare is, well, it's an exciting, innovative area. It takes a lot of money. It's more than most people's pocket change. You're not going to, in this day and age, typically start a medical device company in your garage because of the clinical and development work that's required. It's millions of dollars. And so I started talking with VCs and realized that I was going to have to build stronger relationships with VCs because VCs, for people who don't know, VCs are venture capitalists. I guess I should define that. But they're the people who help fund a lot of these startup companies. And they both love a big company background, but they've been burned by big company people many times who are unable to leave a big company and function in the small company environment. And I had a great mentor who advised me to start my consulting business. He said, look, they'll get to know you and build trust that you won't take the money and go down in flames. That you'll take the money and you'll do something productive to meet the milestones of a business. And that is exactly what happened. As I started working with my consulting business, I did a lot of work for VCs and emerging growth companies. It was fascinating. I also found out I'm not a good consultant. Not that I didn't give advice, but I wanted to run it, not just be sort of an advisor to the team. So consulting means you have to give advice. And then if your client decides to do something else and falls off a cliff, well, there's nothing you can do about that. And I was heartbroken when I saw some clients do things that I thought, oh, I wouldn't have done it that way. And then it didn't turn out exactly as they had hoped. And decided that I really have got to get back into being part of the team instead of advising the team. That's why I said I'm not a good consultant, because ultimately my heart got too involved in really trying to make sure that the businesses could be successful going forward. And obviously I had views about what that could be. So I really wanted to get back into leading a company. And along the way, one of the VCs that I'd worked with said, hey, we're looking at this little business down in Florida. And we'd like you to go down and think about that. And I went down and met at that time the Axogen team, which was predominantly a science team working in a lab at the University of Florida. And I met the founder. So I didn't end up founding Axogen. I found it, but I didn't found the company. I had dinner with the founder, Jamie Grooms, and we just hit it off as that there was a real opportunity in nerve repair. And I had actually looked at nerve repair when I did business development for J&J and couldn't find a technology that met the need. So I actually had a good understanding of what the market need was. And I saw their early preclinical data and said, wow, this is what I had looked for years for J&J. And now I see it in this lab. And Jamie and I philosophically aligned with what needed to be done with the company and how it would grow. So even after that first dinner, I actually called my husband that night and said, I think we got to move to Florida. and so we did. It took a little bit of time. We had to raise some money before that could happen. So that was actually in 2005. And we raised the first VC money, and then they could afford to hire me. And then because they didn't have money before that. And so I did free work for them. But I was officially an employee when they could start to actually cut a paycheck. And that was in 2006. And we were, like I said, rat studies and some interesting work in the University of Florida lab. And today we have a brand new biologics processing center and manufacturing in Ohio. We have a corporate office and labs in Tampa, Florida. We'll do 154 to 159 million in revenue, predominantly in the US, and starting to expand internationally. So it's, fast forward some fun changes over the years.
Yeah, amazing journey, amazing growth, and it was nice to hear you really have put skin in the game. So going into a company like that with no money at the time, no, that's what an exciting journey, and it's come so far under your leadership. So that's really exciting, Karen. Before we get into everything that you're doing now, though, I would love to start because I haven't spent much time looking at the peripheral nerve injury space. I'm more familiar with the numbers around the central nervous system, but when I looked at it, I was really taken aback, both by the prevalence of these injuries and their cost. And just, the CDC data alone, 20 million Americans suffering from some form of peripheral nerve injury, everything from traumas to amputations and everything in between. $150 billion annually spent in the United States alone. Talk a little bit about this, because this is not a small niche market.
No, and it is fascinating to me because I completely agree. It's a very substantial market, and it's a market that had basically not had innovation in 50 years. So it is really interesting to find this space that has been virtually ignored and yet is so prevalent. I used to give presentations I still give presentations. We're a public company at many investor conferences. And I would get a line of people afterwards coming to talk to me. And I thought, oh, this is great. They're so interested in Axogen. They want to know more about investing. And they were all questions like, my wife fell down the steps and she's had this pain in her hand. And so I became the referral group for all of these people because it's that prevalent. And yet people as patients and as clinicians often don't think of it's that the problem is actually a nerve. And so part of what Axogen has done is starting to raise awareness about things that might be called something else, but are actually a nerve injury. And so that's part of the problem, is that while it's so prevalent, they're often called, it's called chronic pain, or it's called paralysis, or it's called numbness. But all of those are things that may be caused by a physical anomaly in the nerve.
Mm-hmm. Mm-hmm. So now, laying that groundwork, let's go in a little bit on what exactly, because your portfolio is rather broad in the sense that you have these very interesting allografts for replacement purposes. You have agents that protect the nerve. You have agents, or we'll call it, I say, devices that cap the nerve and help, I guess, in there with the pain of neuromas. So there's a lot going on here, and I would love for you to walk through it in any way you wish. Sort of the basis for, I guess, the core product, which is the Advanced Nerve Graft, based on some interesting extracellular matrix technologies, but some of these other tools that are involved in connecting and capping and protecting along the way.
Sure. Well, if I take a step back, nerves are injured in lots of ways. They're injured in traumatic injuries. They're injured in surgical procedures. And what we did is go back and say, well, what is common here amongst these types of areas where you have nerve issues? And what is a portfolio that helps surgeons solve their problems? So we really work with surgeons conceptually with three types of things they're trying to do. When a nerve is cut, when a nerve is cut, the simple thing to do is think about nerves as like the wires of the body. So a nerve is cut, just like if you cut a wire, it's no longer carrying signals. And so we want to help a nerve be reconnected or reconstructed in such a way that it restores that signaling of the nerve. We help surgeons when nerves are compressed. So nerves that have compression on them, it alters the signal conduction of the nerve. So nerve now is still intact, but this pressure changes the way the signals are exchanged through the nerve. So you're probably familiar with carpal tunnel syndrome. Most people are aware of that. That's where you have a little compression point right here at the wrist. It causes numbness and tingling and pain in these fingers, as well as pinch strength issues. And that concept, though, is true of any nerve in the body that is compressed. And so you might have those symptoms in other parts of your body and still be trying to figure out why that's happening. And that's a compression issue.
Mm-hmm.
And then the last is when nerves are need to be terminated in some way. So think about, again, like leaving a live wire lying around. That might be problematic. The same thing is true with a nerve that is unended that's left in your body. And that's the obvious place that can happen is in an amputation. So if you have an amputation, obviously there's nothing to connect it with, but there is a syndrome called phantom limb pain.
Yep.
And that's where an amputee may say, my foot hurts. They don't have a foot. Why does their foot hurt? Well, it's that live wire that was left in the body can form a neuroma that sends these aberrant signals back to the brain, and is telling your brain that, since that's the nerve that went to your foot, that your foot hurts. And so we'd help surgeons resolve that and terminate a nerve so that it doesn't send those aberrant signals back. And so if you then look at our suite of products, if I go to first, when nerves are transected, if it's a nice sharp laceration, something that happens, for example, with your kitchen knife, you're cooking, preparing dinner, oops, I cut my finger. That might be a nerve that's injured, but it's a sharp laceration. You're going to go straight into the emergency department to try and get it addressed. They can probably bring the two nerve ends together in a tensionless way and align them. And the nerve connector provides, essentially think of it as a surgical duct tape. It's a way to seal up the coaptation. The scientists would absolutely hate that description because there's a lot of science behind it, but you can think about it conceptually as it holds the two nerve ends together, it seals up the coaptation, and allows restoration of that function without putting tension on the rest of the nerve. So tension is really important here because nerves don't heal under tension. So if instead of it being a nice sharp laceration, let's say it's a surgical tumor excision, now that had a nerve entrapped in it. Now there's a gap in that nerve. You can't just pull it together because that'll cut off the blood supply of the nerve. So now you've got to do something to bridge the gap, and advanced nerve graft is a really ideal solution for that, to create a bridge, still allowing restoration of function of that nerve. And you can also have that happen in things like traumatic injuries. If you crushed, table saws, all of these types of things that people unfortunately get involved in, that can create a gap in a nerve. And again, advanced would be used in that situation. In protection, you're trying to protect a nerve that's intact. So again, it might be something like a carpal tunnel revision, or it might be in protecting a nerve where you have a femur fracture and you're plating that, and then there is compression from a plate that's pressing on the nerve. Those are the types of examples where you might want to protect it. And we have two products for that. We have Axogen, which is a wrap that wraps around the nerve and creates a sleeve. It actually remodels and creates a sleeve around the nerve that helps to keep the surrounding tissue up and off of the nerve, and also helps to prevent soft tissue attachments from tethering the nerve in place. So you want to make sure that it can, because nerves glide as you're moving your extremities. They need to move separate from the tissues next to them. And so this will help create a little gliding tunnel that it can move within. And then we also added recently our Axogen Nerve Protector HA+. So the HA+ protector, just released here in August, helps where you have areas where you have a lot of excursion of the nerve. So particularly something like the elbow here, that's where your funny bone is. People, if you ever hit that, that's actually a nerve. It's not actually, there's a bone there underneath of it, and it has to glide over that bone. And this has an HA layer on the surface of the Axogen that helps to give it more lubricity, so it moves smoothly across that bony surface, and helps to improve the gliding characteristics of the nerve. And then lastly, we have our Axogen nerve cap. My husband thinks that I get all my ideas at Home Depot, but it's like a wire tie in his mind. But it actually is a way to cap that nerve so that as the nerve fibers sprout, that they stay linear instead of getting tangled up and equivalent of shorting out against each other, and also don't continue to grow so that they don't have these aberrant signals that go back to the brain. Mm-hmm. So that's our suite of products, and they're used in a variety of applications, but helping surgeons when a nerve is transected, needs to be protected or terminated.
And just for our, the audience, these products are all classified as medical devices.
Yeah, we're actually agnostic onto regulatory pathway, other than I don't do systemic drugs. So we have quite an array here. Mm-hmm. The Axogen products are medical devices. Mm-hmm. The advanced nerve graft is made of human allograft nerve. So it's a human tissue, and it's regulated as a biologic.
Okay. Excellent. Okay. I appreciate that. So no, I appreciate you laying now the groundwork for all that, because from there, clearly when one goes to the Axogen website and goes into an area called the Axogen Comprehensive Clinical Bibliography, they can see sort of the amazing array of applications that you've been involved in developing, those that you're currently developing. And I thought a really interesting one to start off with, I know you were, before you talk about phantom limb pain and too much stimulation, but I was really interested in the breast reconstruction program known as Resensation, where you talk about there's numbers like a couple 100,000 breast reconstructions in the United States every year. We're good at size, shape, softness, and symmetry, but sensation, no. Walk through a little bit about Axogen's applications here, because this seems like a rather large market. So just looking at surgery following mastectomies. What's Resensation all about?
Yeah, it's an area that I'm very excited about. You're exactly right. Traditionally, when women had a reconstruction following a mastectomy, they were given the shape of breasts. They looked and felt to others like normal breasts. But unfortunately for the woman, she didn't have sensation. That wasn't part of the reconstruction that was traditionally done. And as we started talking with both patients and with surgeons, we actually saw a pretty significant gender impact in that women were uncomfortable talking to their male surgeons about their interest in sensation in their breasts. And yet, when they talked with their female surgeons, they did speak about it frequently. And so we wanted to raise awareness about the problem of numbness, because it wasn't broadly understood both by patients and many clinicians about what numbness meant. And when we talked with patients, they would say things like, I want to hug my children and feel them. I want to feel water on myself. I want to know that when I dive into a swimming pool, I'm still wearing my swimsuit top. Those are, I want to be able to cook, lean over a pot and not be burned. Those are all very real things that happen when you have numb breasts. And yet it really wasn't something that patients were aware of, as they're making a very complex journey here in their cancer care or prophylactic mastectomy decisions. And you really have to decide it as a part of the care pathway. It's not something you can do later on. It's got to be part of the original reconstruction. And so we really sought to first shine a light on the problem of numbness so that patients could make the choice that's right for them. And so some patients choose to have a mastectomy and not have a reconstruction. That is a perfectly fine decision for them. It's also perfectly fine if they decide that sensation is not important to them. But if it is important, we want them to know that up front and be able to ask their surgeon about the opportunity to restore sensation. And if their surgeon that they're working with doesn't know the techniques or do the techniques for neurotization, that they can find a surgeon who does, so that they can be good advocates for the things that are important to their own healthcare. And I'm excited to say that, when we first started this journey, it was probably 2015. We joined with some leading surgeons who were very active in this area, trying to raise awareness about numb breasts. And if I flash forward to today, it's really the hot topic in breast reconstruction, where we're really looking at what can we do now to really get a better quality of life and outcome for patients. And patients are very passionate about this. They really, in their return to quality of life, those are important factors for the patient. And I'm happy now with technology and some very skilled and trained surgeons, we can provide that opportunity for them.
Moving from breast reconstruction and resensation to traumatic injuries, which obviously is a broad basket, everything from neuromas or pinched nerve to amputation. And if I can tell a quick little story, a couple of years ago, my mother chopped her finger off by accident, and it grew back, but it was kind of funny looking, and it was always a little tingling sensation, which I said, Mom, that's sort of your phantom, I guess, some phantom limb type thing going on. That being said, a little anecdote there. You have a lot going on in this space. The one that kind of stood out to me on the website was something called Repose XL, a very large study that you're running together with, I think, the Department of Defense on large diameter injuries. Talk a little bit about what you're doing. I mean, you're doing a lot in the space, but if you could take us through this area as well, because I think everything from obviously repair at the same time the phantom limb stuff, there's a lot biologically going on. So I'd love to hear your different strategies here.
Sure. Again, I think this is a big awareness area where neuroma is vastly, in my opinion, vastly underdiagnosed as a cause of chronic pain. And it can come from a lot of different causes. It could be from a traumatic injury that went unrepaired previously. It could be from a surgical procedure or something like an amputation. In surgery, for example, as a normal part of the procedure, if you're doing a total knee replacement, you're going to end up the surgeon will end up transecting 3 or 4 nerves in order to access the knee. And those nerves are traditionally left as those potential live wires in the body. If this patient comes back complaining about knee pain after the knee replacement, they typically will get moved to a pain center to manage the symptoms of the pain without even historically a thought of maybe we should do a different workup to see if this is caused by the peripheral nerves. It's a difference between treating the cause of the pain versus managing the symptoms. And so we think there's a really great opportunity to come in and help these patients who have, and many times been to 12 to 20 specialists looking for a solution for their pain, to be able to have them go see either a hand surgeon or a plastic surgeon who specializes also in chronic nerve injuries. And that's the terminology they use around this is chronic pain or chronic nerve injuries. And the procedure is actually pretty simple. It is removing that tangled scar of nerve fibers that I talked about can be on the end of the nerve. That's excised off the end of the nerve. And then the nerve needs to be managed in a way that it won't reoccur with that neuroma on the end. And Axogen nerve cap is an example of that. And so the study that you talked about, Repose and Repose XL, there's actually 2 studies. One, the Repose XL, is sponsored by the DoD with a grant, is really around looking at both small diameter nerves and large diameter nerves and being able to provide clinical data on managing that end of the nerve so you don't get a reoccurrence of pain. And so we had a top line data readout of Repose, so that's the smaller diameter nerves, of the pilot study. And that pilot study showed that these nerve caps were very effective at dropping that pain score from something in about the 80 range. So it's on a 100-point scale, an 80 range, dropping it within 3 months down to something in the 30 range, and then over time bringing it down quite low, and being durable out 12 months. So this isn't something that you drop for a little bit and you come back up. You're able to take that person who's in a pretty high level of pain when they're on an 80 on a 100-point scale. You can take them down to something that is really quite manageable or no pain at all. So we're very excited about the potential of this to really reach out and help more patients who are searching for an answer in this area of chronic pain.
What else is coming? I mean, you mentioned, obviously you have most of your revenue here in the United States, but you're expanding overseas right now? Because I thought there was another website that was about maybe your European activities.
Yeah.
Can you talk a little bit about that?
Yeah, so we have started to do some first of all the regulatory approvals internationally so that we can provide product within countries. Most countries ex-US, you also need to think about the reimbursement and economics as well. So we're beginning that work. Our commercial footprint is still very small ex-US, but one of the things that I think is fascinating is these nerve injuries, while we've looked at them in the US, they're true all around the world. And they're true in developing countries as well. And actually, in many cases, may have even a more significant impact into the life of those patients. Because in a developing country, if you're reliant on using your hands to make your living, if you have a hand that doesn't function, you now not only have a quality of life issue, you may not be able to feed your family. And so we look at this as something that we want to continue to expand around the world and provide that opportunity in other countries in addition to the US. So it starts with the regulatory work. We are commercially available in a number of countries in Europe, as well as Israel, Korea, a few other countries outside of Europe as well.
Excellent. And just one other thing, I noticed that one other thing on the website is sort of your educational programs, because it seems like the company is quite active in not just obviously creating this suite of devices and biologics, but also really getting out there and showing how they work in these different forums. Can you just say a couple words about sort of the that component of in sort of teaching and spreading sort of the word about these tools amongst the medical community?
Yeah, well, first I would say as an organization, we're very purpose driven, and our purpose is really thinking about the patient first. And so we start with thinking about what's the patient condition and what do we want it to be, and then think about all of the components that need to change. And certainly products and technology are part of that, but also making sure that we've helped equip the surgeons who actually interact directly with the patients with the best and latest information. So that's the commitment to building clinical evidence so that they can make good judgments and decisions around patient care with a very fact-based approach. It also is thinking about making sure that surgeons are educated on the latest techniques and advancements in doing nerve repair. And so we started a program a number of years ago, training both fellows and attending surgeons so that they could understand both the science of nerve injuries and how nerves heal, but also hands-on skill building in the techniques of nerve repair. And so we have a program that I'm actually very proud of today, where the majority of fellows in the United States actually are trained through the program that we facilitate, led by academic clinicians from around the world. We don't, we are creating this forum for training, but the actual training is actually presented by leading surgeons who go through their own personal experience as well as a review of clinical data, and then help with the hands-on training so that the surgeons leave with more confidence and understanding about the best practices in nerve repair.
Awesome. And one last thing here, while we have you, clearly a lot going on clinically, but you get out there quite a bit, obviously, you're a public company, to the investor conferences, Piper, Canaccord, Jefferies. What's coming up for 2024 where we can be on the lookout for you, other conferences you're going to be at, places that we can run into you, possibly meet you, anything else on the calendar, public facing that I missed, please.
Yeah, we do. We're a public company, so I am at many of the investor conferences that focus in on medtech and healthcare throughout the year. So we will be doing that next year, and we kick off the year right away. In January, there's the American Association of Hand Surgery. There's the American Society of Peripheral Nerve Surgery. There is also the American Society of Reconstructive Microsurgeons. So all three in a row. we get busy with pretty much all of our customers right away in a surgical conferences.
Awesome. Awesome. Amazing stuff, Kara. Amazing journey. I'm always excited when a company starts from nothing and generates hundreds of millions of dollars in revenue, based on real clinically validated products. So I'm rooting you on and exciting to see how this continues to grow under your leadership. Again, for everybody who is going to be listening to this particular episode of our show across the podcast networks, or watching on the YouTube channel. Again, you've been spending time with Karen Zaderej, Chairman, Chief Executive Officer, and President of Axogen Corporation, doing really amazing things, developing these technologies to improve peripheral nerve function and give quality of life back to patients. Karen, I want to thank you for taking the time out of your schedule to come talk to us for a little while about what you're up to. Obviously, thank you for what you do. And as we like to say on our show, thanks for helping to create a better tomorrow for so many people via what you're doing. It's a really awesome story.
Thank you for having me.